Conflict resolution is largely concerned with managing disagreements with others. Anger management is about managing ourselves. Anger is a normal human behaviour pattern, but one with particularly destructive consequences. Angry outbursts, temper tantrums and attacks of rage are common in childhood, but as we grow older, most of us learn to control them. People vary in their susceptibility to anger, from placid, docile individuals to irritable and quick-tempered ones. At the angry end of the spectrum, this behaviour pattern can be detrimental to an individual and the group in which they work, and for this reason, anger management programmes are in use. Formal estimates of the prevalence of problematic anger are not available. Informal estimates suggest around 5% of the population are affected. The usual management approach is to demand that the disruptive individual stops the behaviour or risks disciplinary action. This is suboptimal, firstly because people respond better to inducements than to threats, and secondly because it has not been shown to be effective, whereas other approaches have. Research into the effectiveness of anger management treatment is complicated by the number of outcome variables used. These include self-reported frequency of angry thoughts, behaviour patterns, measures of physiological arousal, self-esteem and response to experimental provocations. This is further complicated by the range of over 90 treatments tested. In meta-analysis, a range of well-delivered anger management interventions may be moderately effective at improving these outcome measures, but it is not possible to demonstrate consistent superiority of one treatment strategy over another. Treatments for anger are psychotherapeutic in nature and involve a range of theoretical models, including cognitive behavioural and psychodynamic approaches. Cognitive behavioural therapy is a school of psychotherapy that treats problems by focusing on their directly observed triggers, progression and consequences in the here and now, rather than probing for and influencing hidden causative factors from the past. For destructive anger, cognitive behavioural therapy explores provoking factors and how to respond to them, the self-sustaining effect of thoughts and behavioural reinforcement in anger escalation, and the consequences of a person's anger on themselves and those around them. This is often administered as group therapy, which creates an environment in which individuals can openly discuss their problems with others who have personal knowledge of them, and without judgment from those unaffected by destructive anger. Psychodynamic therapy is from the Freudian school of psychoanalysis that explores underlying primal motivations and influences originating from repressed memories. The theory is that by bringing these to conscious recognition, their baleful effects can be mitigated. Programs involve either an intensive course over a few days or repeated sessions over weeks or months with detection and treatment of relapse if disruptive behaviour should return. In the USA, several programs are available specifically for medical staff, and in 2008 the UK Department of Health opened a practitioner health programme for medical staff in London that addresses anger. In addition, the Cardiff Deanery has for several years been running a programme for doctors with behavioural problems, mainly anger and aggression related. A common fallacy in anger management is the hydraulic theory, largely attributable to early psychodynamic theorists. It holds that angry emotions are like a fluid under pressure that must be let out or will lead to ill health because they are bottled up. Experimental results show this to be false. Expressing anger, taking it out on inanimate objects by doing acts of violence to them, or consciously seeking outlets for anger all appear to promote higher levels of anger and aggression, impair self-control and delay resolution in anger-provoking situations. A curious fact about anger is that the physiological effects include tense muscles, rapid breathing and racing heart are related to the emotions we feel. This relationship is causal in both directions, so that the emotions promote the physiological responses and vice versa. This is why one of the first steps in resolving anger is to deliberately reverse the physiological effects by taking deep breaths and relaxing muscles. Another thing to note is that anger is a feature of the automatic cognition system and not of the analytic system. Leading the person to switch from automatic to analytic thinking mode is another important part of resolving anger. So how do you resolve an anger situation? Getting angry in return is an automatic reaction we have to anyone who gets angry with us. However, this is unhelpful in resolution. Stop your own anger by breathing deeply, relaxing and getting immediately into analytical rather than automatic thinking mode. Secondly, pay attention to the person, ideally giving them your undivided attention. Being ignored both causes and promotes anger. Thirdly, deal with the angry emotion first. Empathise with the person, let them know you understand why they're angry. Ultimately, you have to deal with the issue that they are angry about, but while they are still angry, you only address that component of the issue, and that is the angry side of the problem. Listen to them and understand what it is they're upset about. Get them to clarify anything you don't understand and listen attentively. The person will calm down, but this may take some time. Only when they have calmed down and not before can you move to negotiating the very issue that has made them angry in the first place.